we have none other than Dr. Stephanie Spano. So please make sure that you are following her and that you are getting in tune with everything that she has going on. Stephanie is a board certified interventional radiologist here with us at the USA Fibroid Centers. And she is absolutely amazing. Okay. Absolutely amazing. And she's here tonight to help us to understand fibroids. So many women are ailing every day with fibroids, and they don't have a space like this to come to. They don't have an opportunity to have a conversation with someone and be able to get answers. I mean, real medical answers. I'm here in Maryland. Dr. Spano, where are you located?
I'm in New York City, and my clinics are in the Bronx and Manhattan right now.
And we're going to talk just a little bit about the UFE, the procedure that we do here at the USA Fibroid Centers. Please tell us tonight exactly about the UFE procedure.
Okay, so UFE stands for Uterine Fibroid Embolization, and it's considered minimally invasive. So it's less invasive than the surgeries that are usually offered to women first. So when women have issues with their period, infertility, all types of other things we can get into later, they go to their gynecologist first, and they're told about, off the bat, hysterectomy, and then other things called myomectomy. So embolization is less invasive than those. So basically, I make fibroids smaller. So to make an incision, they don't need an overnight hospital stay. They don't need general anesthesia. I make them smaller by going into their arteries. So basically, I go into an artery far away from the uterus and use a camera to find my way with this little tube called a catheter all the way to the arteries that go to the fibroids. I treat them right there, and then their body does the rest of the work for the next couple months.
Was there a particular story that led you to wanting to be, you know, a UFE specialist? Like, tell us about that journey.
Sure. So when I was in residency, so I was at Stony Brook out in Long Island, I had some nice mentors in interventional radiology, and my favorite one was someone that specialized in fibroids. And I just saw how much he helped all his patients. There was such a range of age. You know, he was helping people between ages 30 and 50, coming with all different types of issues because of their fibroids. And I saw how much it made a difference. And then when I got to the fibroid clinics, I saw how many women that were reaching. It's way more than the hospitals see. Like, we have so many women coming in with these issues that don't even know what they have, why they have to deal with this every day for years and years. So just the more patients I meet in my own clinic, the more excited I get to do these treatments.
I know that there's several different treatments, and you specialize in the UFE, the Uterine Fibroid Embolization procedure. Can you tell us if there is a difference between that and the ablation?
Yeah, so ablation is when, again, it's something that a gynecologist does. Typically, they go transvaginal, and they use a laser to target the fibroids that are in the uterus. So my procedure, it's not transvaginal. The benefit of that is a lot of women ask me when they first come and hear about this procedure, does it matter if I have my period when you're going to do the procedure? No, it does not matter where you are in your cycle, because all I'm doing is going to an artery far away from your pelvis. So laser ablation makes fibroids smaller too. The same idea is there, but the way that I versus a gynecologist gets to the fibroids is different.
I received my surgery. Unfortunately, I had a hysterectomy, and I say unfortunately because I was down for a very long time. I was out of work for 6 to 8 weeks, and I lift heavy things. I'm lifting 50-pound cases every day of makeup. I'm a makeup artist by trade, and it was very difficult, the healing process, and me just getting through just having to be away from work that long and healing from just being cut, and just having this whole process of understanding my body again, not having all of my body parts, you know, and knowing that I now cannot have a baby. Tell us what the advantages of UFE are versus the other surgeries.
So it's been proven for a long time that UFE leads to shorter time away from work, shorter recovery, less painful recovery, less time in the hospital, less expensive, because it's an ambulatory procedure. The biggest benefit of women coming to me and talks about their fibroids is so that I can explain to them that hysterectomy is not the only answer. Certainly, if somebody wants to do that, that's the number one option for them, then of course it's your body. Do what you need to do to feel better. But definitely it's not a requirement. You know, having fibroids is not the end of being able to try to have a child. Basically, you know, having months and months off from work, healing from the complications of incisions, you know, possible infection, the other complications that could come with, it's called a laparotomy when they go in and, you know, take out the uterus. You know, those kinds of things are not happening after a UFE. It's just, it's a shorter recovery process. And most women go back to work between 1 and 4 weeks later. The success rate of UFE is more than 90%, which means which means about 10% of the time or less, yes, women might not feel the relief they expected to feel 6 months after the procedure. So women should give it a full 6 months. But basically, women should know that after they get UFE, their fibroids are treated for the next 8 to 10 years. And when women come to me, they're usually in the second half of their 30s, early 40s, 8 to 10 years down the line. They're going to be closer to menopause. If their fibroids come back, they're not going to bother them. I just think as soon as someone says to me that they've been suffering for years with this, they're suffering almost every day out of the month, it's just so upsetting every single time, because they must have asked about this before they came to see me, right? And they didn't know what the options, or they're not big enough to treat yet. Your symptoms could be worse. A hysterectomy is the only option for you. And it's just, you know, I just wish, you know, they would find a way to us sooner, just so they could, you know, one, get their life back faster, but two, also just know that like there's so many different treatment options.
So I am so thankful for this conversation, Dr. Spano. You have been amazing. Amazing. The ladies have enjoyed you, and we appreciate your time. We appreciate your love and your candor for what you do. We could not do this without you.
Thank you so much, Kym. I really appreciate your time too, and for everyone listening. Thank you. It's been so great.